Exparel, bupivacaine liposome injectable suspension, is indicated for administration into the surgical site to produce post-surgical analgesia. Please see the full prescribing information for Exparel at www.exparel.com. Severe pain following surgery affects 20 to 40% of patients, despite advances in pain management. Surgical site infiltration with local analgesics is considered effective for controlling post-surgical pain and can reduce the need for opioids, which are associated with adverse drug events. The analgesic response is surgical site-specific and limited to the duration of action of the local anesthetics. Exparel, bupivacaine liposome injectable suspension, is approved for single-dose administration into a surgical site to produce post-surgical analgesia. Pacira Pharmaceuticals Incorporated recognizes that there are alternative methodologies for administering local anesthetics, as well as individual patient characteristics when selecting a dose for a specific procedure. The recommended dose of Exparel is based on the surgical site, volume required to cover the area, individual patient factors that may impact safety of an amide local anesthetic, and a maximum dose of 266 milligrams. Exparel delivers bupivacaine to the surgical site using depot foam technology. Depot foam, composed of multivesicular liposomes, slowly releases bupivacaine into the surgical site to provide extended post-surgical analgesia. For optimal efficacy, meticulous infiltration with multiple injections to all relevant tissue layers of the surgical site is recommended, with frequent aspirations to reduce the chance of an inadvertent intravascular injection. Administration technique can impact analgesic effect in surgical site infiltration. Therefore, Exparel should be injected slowly into soft tissue with a 25-gauge or larger bore needle, using a series of injections that cover the entire surgical area. Exparel can be administered undiluted or expanded to increase volume up to a final concentration of 0.89 milligrams per milliliter, a 1:14 dilution by volume, with normal 0.9% saline or lactated Ringer's solution. The total volume of Exparel should be adequate to cover the entire surgical site, with careful infiltration to anatomic areas with high nerve density. In the case of total knee arthroplasty, this includes infiltration of the posterior capsule, tendons, periosteum, fat pad, ligaments, and subcutaneous tissue. This particular approach is the basis for the PILLAR study, a Phase 4 randomized controlled trial comparing infiltration with Exparel versus infiltration with standard bupivacaine. The PILLAR study concluded Exparel patients consumed 78% less opioids through the first 48 hours following surgery compared with bupivacaine patients. 10% of Exparel patients were opioid-free through the first 72 hours following surgery, compared with no bupivacaine patients. Exparel patients had 13.6% less pain through the first 48 hours following surgery, compared with bupivacaine patients. Bupivacaine hydrochloride administered together with Exparel may impact the pharmacokinetic and/or physicochemical properties of Exparel, and this effect is concentration dependent. Therefore, bupivacaine hydrochloride and Exparel may be administered simultaneously in the same syringe, and bupivacaine hydrochloride may be injected immediately before Exparel, as long as the ratio of the milligram dose of bupivacaine hydrochloride solution to Exparel does not exceed 1:2. For larger surgical sites, Exparel may be expanded to achieve optimal coverage. When 20 milliliters of Exparel is expanded to a greater volume, the diluent acts as a carrier, spreading the liposomes over and around the surgical site. Upon administration, the diluents are rapidly absorbed, and the multivesicular liposomes remain near the site of administration to form a bupivacaine depot at the injection site. Encapsulated bupivacaine is released over time through particle rearrangement, lipid metabolism, and diffusion of bupivacaine from the liposome. Exparel is a novel bupivacaine formulation that can be incorporated into opioid-minimizing multimodal regimens for post-surgical analgesia and has been used in over 3 million patients in a broad range of surgical procedures, including orthopedic, breast reconstruction, general surgery, colorectal, GYN surgeries, plastic, and oral surgery.